This is Camille Fisher, who's a genetic counselor at Dell Children's Medical Hospital. Correct me if I'm wrong. So we're just going to ask her some questions to get to know more about the field of genetic counseling. So our first question is, like, in general, what is a genetic counselor?
Yeah, so genetic counseling is a relatively new profession. Genetic counselors have specialized training in medical genetics and in psychosocial counseling. Most genetic counselors work in healthcare settings, so most are clinicians, so that includes myself. But the field expands every day, so I'm still keeping up with where all genetic counselors have expanded into these different roles. But there's a lot of genetic counselors who work for laboratories, so do things like report writing or variant interpretation for labs, or helping other providers with interpretation of genetic testing results, as well as working in research settings. So some genetic counselors might do clinical research or otherwise. Genetic counselors also work a lot for advocacy, so like disability rights, that type of thing. So it can be really broad, and genetic counselors are very motivated people typically. So our program director is very much like, if you see an opportunity, you want to create a role for yourself, do that. So a lot of genetic counselors do kind of create their own position too. But the primary training is in medical genetics and in psychosocial counseling.
Okay, so you said that you would work in like labs, hospitals, but there are like clinicians. Why might someone like think, okay, it's like I should go see a genetic counselor, like in that situation?
Yeah, there's lots of reasons. The three primary areas of genetic counseling, which most genetic counselors would have a traditional training in, would be prenatal or preconception counseling. This would be where you have a concern for risk to have a child with a genetic condition. So that's a couple who might have concerns either prior to conceiving a child, or if there's a concern after a child's already conceived. So something comes up on some other screening or an ultrasound where there's concerns for the fetus or for the baby, where additional testing or genetic testing might be recommended. A genetic counselor might be brought in at that point. And so that counseling can really take a look at, if we diagnose, find a genetic diagnosis prenatally, what can that look like for a family on the postnatal end, just helping a family prepare for what that looks like. As well as sometimes there's also, delivery recommendations or postnatal recommendations where we want other providers in the room at the time of delivery, things like that. So a lot of people tend to have this idea that we counsel on termination, which is we talk about all options, but that's not the primary focus of our counseling. The other main area would be cancer. So this would be where we're thinking about hereditary cancer syndrome. So some people will say to me like, oh, I have cancer in my family, and that's not really what we're thinking of. So cancer is very broad. Many people have, usually some type of experience with cancer, but when we talk about hereditary cancer syndromes, we're usually thinking about people who have experience where they might have family members who are diagnosed with cancer at very young ages, really aggressive types of cancer, multiple family members who are affected. That's really what a hereditary cancer syndrome looks like. And in that case, population screening doesn't really work for them. So starting colonoscopies at age 50, for example, doesn't make sense. We need to offer some other type of screening or other type of intervention. So that could mean surgery, that could mean prophylactic surgery, that could mean starting screening or just having, even medications or something else as part of your regimen to help lower or reduce your risk. And then thirdly would be general or pediatric genetics, which is where I work. That's really after a child or adult who's already here out in the world, we have some type of reason to think that they have a genetic disease. And in pediatric setting, that usually has to do with development. So they're not hitting developmental milestones, and we have concerns either that there's defects in other organ systems, and altogether we think that it could be a genetic cause. And so in that case, we're really trying to answer the question, why? Why do we see all these things clinically? And families are usually really happy to talk to me. And the other two settings, it's not really as much of a positive interaction sometimes, but in pediatrics, parents are really, wanting to get the answer to that question. So if I'm able to help them say, yes, here's why, here's the answer, here's what we can do about it, Families are really grateful, and so that's why I've chosen to do what I do. But that also goes for adults as well. So adult indications could be like cardiac conditions, connective tissue conditions, other things which fall outside the realm of cancer, where you might be counseling an adult about a genetic disease.
So what is your educational background? Like, what education did you have to get to where you are?
Yeah, so genetic counselors have a bachelor's degree. It does not have to be a bachelor's in science. Mine is. So I got my degree from the University of Texas at Austin. And hemobiology was my degree concentration, which at the time, I don't know if it still is this way, but they broke it out into like sub-concentrations. So mine was biotechnology and genetics. So it was like fitting. I could throw genetics in there somehow, but hemobiology was my degree. And then I took a year off, kind of trying to still figure out what I wanted to do before applying to graduate programs. And most graduate programs for genetic counseling are very small, but it is a master's in science program, which would usually take anywhere from like 4 to 20 students. Most programs are about like 6 to 8, so they're very competitive to get into. And it's a 2-year master's program. So I went to the University of Wisconsin in Madison, spent 2 years there. You start clinicals right away. It's really fast paced, so it flew by. But yeah, it was awesome. I really enjoyed that.
So what sparked your interest in genetics? Because you said that you like threw genetics in with your bachelor's degree.
Yeah.
From day one, you were like, this is something I like, or?
Yeah, so my parents both work in research and in science. So I had tried laboratory science when I was in undergrad. So I worked for a research group here at UT who did microbial research. And so I kind of got some experience with bench science and realized how frustrating that can be. And so while I really enjoyed it and I learned a lot there, I kind of figured, there is this part of me that wants to work with people and be involved with the healthcare side, even though nobody in my family has touched healthcare and I didn't really know what that would be like. But yeah, genetics really, I, from day one, kind of knew that was the area I liked. So genetics is a prerequisite here at UT for all the bio degrees. And I had an awesome professor, Dr. Figlia. I don't know if she's still here, but she's amazing. And so just her enthusiasm for it, I was just like, yes, this doesn't even feel like studying to me. I like what I'm learning. I could go home and do more and more of this. I found my niche. And at the time, I think UT is still, very much investing in the microbial cell biology side of genetics. I think now with the medical school, they're getting a little bit more pushed into human genetics or the medical side of it. But at the time, I thought, well, maybe that's the only thing I can do with this, is I can work in a lab. And so me trying to explore that, I realized I didn't really like that. So I had to kind of try to find other avenues. And genetic counseling just happened to be on this little piece of paper that one of the career counselors had given to me, and nobody could really tell me what it was, so I just had to hit the internet and start trying to reach out to people. Yeah.
Would you say that, as a genetic counselor, there's a growing demand for genetic counselors? Because I've never heard of it before, so I figure it's kind of a small field.
Yeah, so right now the estimates are, I think, about 4,000 of us within the U.S. There are more in Canada, and there's a small group within the UK and Europe, as well as there's a really small group in Africa as well, which is awesome. And there's a tiny enclave also in Australia and New Zealand, which have their own certifying bodies. But the National Society of Genetic Counselors is the main group here in the U.S., and the American Board of Genetic Counseling is our main certifying body here in the U.S. So it's 4,000 by their estimates about here. So that's really not that many, and we talk a lot, so I just came back from the national meeting, we talk a lot about access, we talk a lot about the fact that genetic services are very spread out, very difficult for patients, especially those who come from lower socioeconomic backgrounds, to gain access to. So we talk about what does that really mean for our field, and how can we kind of address those issues. So a lot of genetic counselors kind of moved into this area where they're doing telecounseling. So they're working on Skype to try to reach people who are not able to travel to larger cities. So most of us would be stationed within a larger city as part of our clinical role, but we'd be trying to do other types of outreach, whether that means we travel to another clinic that's within, to serve a poorer served community. So whether that's special populations. So when I was in Wisconsin, Wisconsin that was outreach clinics to serve the Amish communities because they're obviously not going to travel to see us, but they still need the services. Here in Texas, sometimes that means doing telecounseling to reach people in the valley or things like that where they're not able to come meet us where we are. And a lot of times that really means that genetic counselors need to do things like learn Spanish and make ourselves accessible. So I think a lot of us have realized that that's a problem and tried to address that. But yeah, it's still relatively unknown. And we just talked about at the national meeting, like, why is that? And are we only attracting a certain type of person as well? Are we only attracting wealthy white women into this profession? And that's not what we want. We want people who are diverse, because when you have diverse providers who are providing the care, you see better outcomes for patients. So you want providers to look like the population that they're serving, because that ultimately ends in better outcomes. So we're trying to address that as a profession, but genetics as a whole is usually, it's not a money-making side of healthcare, right? If I worked in cardiology, right, the medical institutions or the healthcare institutions that I work for might listen a lot more to what I had to say, but genetics, it usually costs a lot of money. I'm usually a money sink for the institutions that I work for as opposed to making them money, because the testing is very expensive. And I think we're still really pushing to try to get other providers in the health community as a whole to see that when we use this correctly, this really does change outcomes. We can use it in a way to personalize medicine, to tailor our treatment plans. But in terms of being profitable for healthcare, it's not really there. So sometimes we kind of get drowned out by other providers, other specialties. So I think that's really frustrating for us as well, to that extent. But I mean, there's other good things as well. I think genomics and genetic medicine has this other really exciting side to it. And people also feel this ownership of their genetic material or their genetic information that really wants to get them involved and working with you. So I have a lot of people call me up like, I got my 23andMe, I want to come talk to you. Like, so there's this other side where people really do want to engage with you, and I think if there's ways that we can capitalize on that, maybe we can try to get other buy-in from other people, or other other interest groups, getting more buy-in to our profession. But yeah, I'm glad you guys reached out, spreading the good word. Yeah.
What does like a typical day in your job look like?
Yeah, so a typical day for me, I do a lot of prep work. So because I work in pediatrics, what I'm seeing day to day for my clinical visits is very different. So every patient I'm seeing is generally a new indication, something that I haven't seen before, and sometimes it's something I haven't even heard of before. And that's because we're learning new things in genetics all the time. So a lot of things that come back, we come back on something that's called exome sequencing, where it could be a novel gene or a new variant. So a lot of what I do is, pulling literature to say, has anyone else been seen with this before? What do we know about this gene? Because it's not something I saw in my training. A lot of my training was geared towards, you're not going to know a lot of what Larsen and Dorsey need to be able to use your research to figure out where to go, how to figure out how to help this person or how to communicate with them. A lot of what I do is also creating visuals to try to help in my interactions with patients. A lot of times I also have to think about if there's anything that goes along with the condition, like if there's a visual impairment or a hearing impairment or something else that goes along with the genetic condition, what is that going to mean for how I counsel them or how I need to explain or work with that individual. A lot of times I'm also supporting my docs. That means I'm also looking at their schedules as well, pulling resources for them, communicating with the lab to double check genetic variants that came back on testing reports. A lot of, we work directly with lab genetic counselors as well to say, hey, this variant came back, I'm not sure why you guys called it this way, can you give me more information about this, can you tell me the specs on this test, would we have detected this on this test versus not, do I need to think about this other follow-up testing? So I do a lot of that backtracking homework before I even meet with the patient. So that's kind of what I do in the morning. In the afternoon is patient. So that's when I'm in clinic, and that's when I would be, really busy, kind of in and out in my clinic rooms. And the geneticists do staff with me, but really, that's a lot of my time where I'm, one-on-one with patients, one-on-one with families, and that's where not only am I spending a lot of time educating, but I'm also my approach is very different from the geneticist. The geneticist, their role is really to make a follow-up plan, to talk about treatment. And while I do make recommendations for treatment or recommendations for follow-up, I don't do physical exam. I'm not medical in that way in terms of diagnosing them by feeling on them or touching them, that type of thing. Everything I do is related to the testing. But my approach is a lot of how do I help you make meaning out of this?
Mm-hmm.
How do I help you understand what this means for you and for your family and for your child right now? It can also mean how do I communicate this to other people in my family, because it doesn't just affect you, it affects other people in the family. How does this change your understanding of your identity now that you have this genetic diagnosis? So I draw in a lot of my counseling skills as well, which is something that the geneticists often don't have time to do and aren't trained to do. So that's often where I come in, and so if I'm seeing somebody who's off of their schedule where they just got a really difficult diagnosis or something like that, that's a lot of what I spend my time doing. It's more of the counseling side as opposed to the let's talk specifics, genetics.
Mm-hmm.
Genetics, a lot of it is, what does this mean? Let's talk about how you feel about this. Let's talk about how you're going to move forward from this. Let's talk about how you're going to use your own strengths to be resilient and take this information and move forward and be empowered with it.
Mm-hmm.
So that's what my day-to-day is.
Yes.
Yeah.
What is the most difficult part of your job? And also, conversely, what's your favorite part?
There's a lot. I can say to that. Difficult things that I'm still struggling with, I think, in my job. I struggle a lot with, there's always hard days. There's always hard days when you're giving bad news and it's never gonna feel good. Even though you're doing your best to help that family or that person through that, you're still the person delivering that. You're still the person that, some people want nothing to do with you after you give them bad news, and I just have to understand that that's their reaction to the news and not to me. But sometimes that can be really hard, especially when I don't work with other genetic counselors, I work with other geneticists. So there's not a lot of people who have my same training or my same background who I can kind of debrief with, or, if I'm in a bad state and I just want to, in training, I can kind of just be like, I need to cry on you, can I take a minute? And it was understood that, yeah, that's fine. But I think I'm still navigating that, how do I professionally make it through those hard days, and I'm in a professional setting, what do I do to make it through and still be in my blazer and in my office and but it can be really hard. And then additionally, because I work in pediatrics, sometimes you're giving bad news to people who don't understand it because they're children. So sometimes I'm giving bad news at a very low level where I know I'm not fully explaining, or I know they're not fully grasping it, but that's all I can do in that moment, because that's the level of the conversation we're going to be having, and that's all that we can have. And sometimes it's frustrating, it's difficult. The family or other family members in the room might have a better understanding, but I also know that I need to treat the child as my patient. So genetics is a very different specialty, because we talk about having autonomy or ownership of genetic information. It is, when you know this information, now you know it. And so that's something that person's going to have to grow into. It'll be with them their entire life. So if that's the level of the conversation we have that day, that's the level of it, and they'll come back and we'll have to have more conversations throughout their whole life. But sometimes it's really difficult to be in that spot. Things that I love about my job, I love that I get to see somebody really asking questions and just being like, oh my gosh, this makes so much sense. Running through the report with me, or running through the articles I pulled, and yes, my child had this, oh my gosh, this explains why they're not sleeping at night, or this explains why they have this weird seizure pattern that we couldn't explain before. Seeing a parent kind of connecting the dots when we get an answer is super rewarding. It doesn't change the reality of their situation, but it kind of gives them something to hold on to, I think, and to understand, and to kind of focus on that's outside of themselves and outside of this worry and outside of this, what did I do wrong? It kind of gives them this, you did nothing wrong. This is the answer. Here's why we see these things. And then additionally, here's what worked for other people, so here's what we're gonna try to do for your kid. So that's awesome to get to see. I love when we get to have, not only do we find an answer, but here's what we're gonna do about it. That's awesome. We don't always get there, but when we do, it feels really good. Yeah.
So, how, we're all undergraduates obviously,
Yeah.
but how was your undergraduate education helpful in what you do now?
I'm a big believer that any education you get is helpful for anything you do. Maybe that sounds really like a non-answer to that question, but yeah, I think I was really allowed to explore kind of all of my interests in undergrad, and I didn't really know what I wanted to do when I started out. So I entered undergrad thinking I wanted to do creative writing. So nothing at all related to science or biology, but the fact that I got to explore that side and then kind of say, this feels weird. I feel weird not taking science and math classes, like that feels wrong to me. But at the same time, I got to explore that piece, and I still write regularly. I still, in my profession now, have found ways to reach out to genetics-related publications and submit articles for them. So I think there's so many sides to every person, and like undergrad is the best place to explore that. Because you're with all these people who are experts in their field and who are really excited about what they're doing and really are, they wouldn't be educated if they weren't passionate about it. So it's just amazing to be around people who you can feed off of that passion. So like I had a calculus professor who I never thought I would like math, never thought I would really be super into math, other than like statistics or the math that I like. But I had a calculus professor who just did a giant proof across all of the chalkboards in the room and just stood out and was like, isn't it beautiful? And like you just feel how excited she was by it, and it made you excited about it. So I think like undergrad, and if you're around people who are good educators and are excited about what they're doing, it can just really ignite those passions in you. And so that's, I think, all of that, and just getting to explore that, learn from others, learn from other your classmates too, and getting to meet people who are different from you, coming from different places and have different interests. Undergrad's awesome if I could stay in college. Yeah.
As a student, like undergraduate or graduate, what was the best piece of advice that you received?
I think I would say along those similar lines, just don't pigeonhole yourself too early. I think I had people kind of tell me, if you want to take that art history class, even if it doesn't count towards something or you can't make it line up for your degree, but you want to take it, do it. I took Arabic as a language credit, even though I didn't need the language credits, but just because I wanted to learn how to write it. And that's actually been really helpful for me, because when I see Arabic speaking patients, I can bring this cultural competency to those interactions that I wouldn't have had before. So you take away what you bring into those situations. So if you're interested in it or you feel like you're going to get something out of it, I say 100% go for it. And undergrad's the place to do that. Even though, it's an investment, it costs money, so don't do it just because, do it if you have an interest in it. But I think this is a place where you really can explore, and if you find, hey, like this isn't what I thought it was, or I think I might like this better, this is a place where you can say, I like this better. Like this is where you can figure that out. So this is where you don't have to have it all figured out. And I think a lot of people try to do that, and it can be hard not to be envious of people who seem like they have it figured out really early. You're like, why don't I have my shit together well enough that like I already know, like why don't I know? But uncertainty is just a real part of life, and exploring that uncertainty this is the time to do that. So I would say that's my best advice. Yeah.
As a genetic counselor, are you the one that is like taking samples and sending it off to a lab, or are you more counseling the patients that you have?
So it can be both. So in terms of like actually collecting a specimen, it depends. Depends on the type of specimen that we need. If it's a blood specimen, I was not trained in phlebotomy. Some programs do train you in phlebotomy. So like the University of Alabama program, they will teach you to draw blood. And some geneticists that I work with, they are old school and they were trained to do that, so they will right there in the room, they'll just draw it themselves. But no, we have a lab, so usually I'll send the patients up to the lab and say, okay, we're gonna get blood draw, they'll send it out to the lab. Most genetic testing laboratories are off-site somewhere else, so nothing's like here in Austin that I would send to. It'd be like in Maryland or California somewhere. But if it's something like a spit kit or a buccal swab, something like that, yep, I'll have to be in the room, like, spit in this too, like, no bubbles, like, make sure you fill it up, like, so it depends on the type of specimen that you're collecting. I just think it's like a skin biopsy or something, no genetic counselor would biopsy somebody. But counseling on results is probably the main part of, what we're there to do, and really, actually spending the time to sit down with somebody and say, here's what this means. Because genetic testing reports are not easy to interpret. They're not even easy for other providers to interpret. So there's a whole class of genetic counselors who they work for laboratories, and their whole job is to explain to other doctors what does this test result mean, because it is so confusing. And if you have no background in it, which most other medical professionals don't, so doctors, other physicians, they get maybe like 4 weeks of genetics training throughout their whole medical career. And that can vary program by program, but most of the time they don't have the same background in genetics that we do. So a lot of times what I'm doing is clarifying for other physicians, this is a mistake, you don't understand this correctly, here's what we need to do to correct this, or here's what this actually means, or here's how you need to use this to tailor your treatment or change what you're doing. So that's what my role is. And there's a lot of providers who will order genetic testing thinking that it's very simplistic, almost like, oh, this will get us an answer, and then I'll move forward from there, and then they get a result back that's really uncertain or unclear, and then not know what to do with it. And then we kind of get called in to like clean that up because they didn't know really what the possible outcomes were. And then so a lot of times I'm sent in to say, okay, your physician didn't really discuss this well with you, but here's what happened, here's what the outcome was, here's what the steps could be that we could take to kind of go from here. So it's a lot of misconceptions, and I think genetic testing laboratories are really trying to expand like who's using testing, so they don't really care so much about the education piece. I think they do try to do some of that, but not enough sometimes, so that there's providers who will say, oh, well, this lab came in and they said order all these tests and I'm going to go ahead and do that, without really knowing a lot about what that testing does technology-wise or what the outcomes are. So a lot of times I get brought in to do that. But on the counseling side, in terms of for the family, it really is, how does this personally make meaning for you? What does this mean for you in terms of what are we going to do for you clinically? What does this mean for you in terms of now you have a genetic diagnosis or not? Because it is always finding something out about yourself. Mm-hmm. So it's I think it's different really than, a lot of people ask me like, isn't it just a blood test? Yeah, you're just drawing blood, but we're also finding out information that has implications for you in a different way than other blood tests do, as well as probably for your kids. So we're talking about something that's a little bit more broader than, like a cholesterol level or something like that. So really a lot of it is kind of honing that in and saying, this has other implications beyond just like your white blood cell count or something, So yeah, that's the majority of what I'm doing day to day. Mm-hmm.
Any other question?
What kind of person do you say would go into the job of genetic counseling? What kind of personality or what sort of interests, special interests in genetics would they have to go into genetic counseling?
Yeah, I think that's a question we're all asking ourselves in the national meeting is who is this person that we're attracted to the profession? Because I think we do really want to expand who we are bringing into the profession as well. Most genetic counselors tend to be very strong-willed women. The majority are women. Most have some, very strong interests in science or genetics, from their, undergraduate area, but not all. Some come from other backgrounds. So some might have had a previous career and then changed careers and decided that this is what they want to do. So some genetic counselors might have been working in other advocacy settings and then realized, oh, I want to be here. Some of my classmates, one worked as a medical librarian for several years, one worked as an architect for several years, and then became a genetic counselor. So a lot have varied backgrounds as well. I say the majority do kind of come straight from undergrad into the profession or into the master's programs. Most tend to be really, what programs are looking for and what they value would be people who are very flexible. So people who are not very rigid in how they like to do things. Because in the job and in the career as a whole, you're going to be dealing with a lot, and you're going to be juggling lots of different things, wearing lots of different hats. And so in order to grow the profession, if we want people who are going to be involved in research and teaching and doing all these things in order to grow our profession, they want people who are going to be able to juggle lots of different tasks. So one of the things they look for a lot is, are you flexible? Can you handle different things day to day? Are you a person who can juggle multiple tasks at the same time? And then do you have like an enthusiasm and passion for what you're doing? So that's one of the reasons that the in-person interview is really important for most master's programs. And they also have somebody who they think can really handle a lot of the psychosocial concerns that would come up for genetic counseling. So most programs would require that you have some experience with crisis counseling. So either like most individuals have like worked with like rape crisis centers, homeless shelters, things like that, to kind of show that like, yes, I have experience with this, and like, yes, I'm comfortable being uncomfortable, because you're gonna be uncomfortable in genetic counseling sessions, and a lot of times you're gonna be the person sending somebody into crisis. So just showing that you can handle that, you're emotionally able to take care of yourself. Self-care is very important. So really showing that you have a strong background there in your own psychosocial skills. But yeah, I would probably say flexibility is like the number one. Yeah.
Any more questions? I think we're
good.
Thank you so much for letting us talking with us.
Of course,
It's
yeah.
been a pleasure.
Of course. I filled your time.
Yes, I think so.